Hello, I'm Catalina Escobar and today I'm going to be demonstrating some exercises and stretches that we can do with patients that come in with wrist or hand pain or any conditions associated with this area. So the first one that we're going to be doing today, it's called flexor tendon gliding. So this exercise has 5 different hand positions and this exercise is designated to develop the free gliding between the flexor digitorum profundus and the flexor digitorum superficialis with a wrist in the neutral position. So the first position is a straight hand. So this position, as you can see, all the joints are going to be extended. The second position, it's going to be claw fist. So we're going to go like this. In the claw fist, we have extension at the MCPs and flexion at the PIPs and DIPs. And then the thumb is going to be in a neutral position. Then the third position is called full fist. So we're going to go like this. All the joints are flexed on this position. The fourth position is called tabletop. So we're going to go like this. The MCPs are going to be flexed and the PIPs and DIPs are extended. Then from here, we're going to go to straight fist. So in the straight fist, this is the last position in which the MCPs are flexed, the PIPs are flexed, and the DIPs are extended. And the thumb is in the neutral position. Next is the flexor tendon blocking exercise. This exercise is a progression of the flexor tendon gliding exercise that we previously did. So this exercise should only be performed after the person has accomplished the normal tendon gliding, not before that. Also, this exercise should not be performed in the early stages of flexor tendon healing after a repair because of the great stress that is placed over the tendons. Okay, so this exercise is very important because it does not only provide that tendon gliding, but it also adds the neuromuscular control of each individual joint. So on this exercise, what you want the patient to do is you want the patient to flex only one joint of each individual finger. So to do that, the patient is going to have the forearm pronated and the dorsum of the hand is going to be placed on a padded table like this. So I'm going to do everything with my left arm. So we can do this exercise to improve flexion at the MCPs, at the PIPs, and at the distal interphalangeal joints. So first we're going to do the MCPs. So we're going to start with the hand flat like this. And so each exercise you want to tell the patient to try it without using the opposite hand and stabilizing the other joints. If the patient is unable to do that, then you're going to take the opposite hand, stabilize the other joints by keeping them in extension and flat on the table. So for the MCPs, it should look something like this. First, I'm going to try without using my opposite hand. So we're flexing at the MCPs, and the PIPs and DIPs should remain extended. If the person needs assistance with the opposite hand, so it should look something like this. Okay, now we're going to do the flexion at the PIPs. So for that one, we let the patient try first, and then if they're unable to do it, then we're going to tell them to use the opposite hand to stabilize the joints and keeping them in extension. So we're going to flex at the PIPs and keeping the DIP extended. I'm doing pretty good right here. Okay, now if a patient needs assistance, then we're going to take the opposite hand and we're going to block. We're going to block the first phalange and we're going to do the same thing. When the patient has gained that neuromuscular control, then they will try without assistance. Now to do flexion at the DIPs, the MCPs and the PIPs are going to remain extended and they're only going to flex at the DIPs. So it should look something like this. Remember that they're going to first try it without assistance of the opposite hand. I cannot do it, so I'm gonna use my opposite hand to assist myself and keep those other two joints extended. And as you can see, I'm trying to isolate each finger, but it's hard for me to even do it. Now, whenever the patient has gained this neuromuscular control, they will do it without assistance, and then if they can already do it without assistance, they can progress that by adding some resistance with the opposite hand, so adding some resistance to each of the specific motions. Next is the extensor tendon gliding. I'm going to demonstrate it with my right arm, but we will be doing it the same with the left arm. So for this one, we're going to tell the patient to go from a full fist to a hook fist, then from a full fist to a tabletop, then from a full fist to a straight hand, and then from a full fist to a long horn, like this. And then they're going to repeat that again, from a full fist to a hook fist, from a full fist to a tabletop, from a full fist to a straight hand, and then from a full fist to a long horn. Next is median tendon gliding. For this exercise, we're going to tell the patient to do it 1 repetition 3 to 4 times per day. This exercise has 6 different positions, and I'm going to be showing those 6 positions in a minute. So for this exercise, the patient is going to go through these positions until they feel tingling on their fingers or their hand. Whenever they feel the tingling, they're going to hold that position for 5 to 30 seconds. If the tingling increases, they're going to go back 1 step. Then they're going to alternate between that step and the previous step. Now, whenever they don't feel symptoms anymore, they're going to go up 1 step, and then they're going to alternate between the next 2 steps. So the 6 positions that we're going to have for this exercise are, so the first one is going to be the wrist in neutral position, and the fingers and the thumb are going to be flexed. The second position, we're going to have the wrist in neutral position, and the fingers and the thumb are going to be extended. On the third position, we're going to have the wrist extended and the fingers extended, but the thumb is going to be in a neutral position. In the fourth position, we're going to have the wrist, fingers, and thumb, all of them are going to be extended. On the fifth position, we're going to have the wrist, fingers, and thumb extended, and the forearm is going to be supinated. And then in the sixth position, we're going to have wrist, fingers, thumb extended, forearm supinated, and then we're going to add some stretch into extension of the thumb, just like this. Remember that it's very important that the stretches are only performed after normal tendon gliding has been achieved, not before that. And then they will do it with you. Next is ulnar nerve gliding. So this exercise is going to have basically four different positions, and we're going to want the patient to do 1 repetition 3 to 4 times per day. So we're going to tell the patient that they're going to go through the positions, and they're going to stop whenever they start feeling any numbness or tingling. And then they're going to hold that position for 5 to 30 seconds. Then if the symptoms increase, then you're going to tell them to back up 1 step. And then they're going to alternate that position with the previous position. So they're going to go back and forth in the positions. Now, whenever the patient is not feeling symptoms anymore, then they can alternate between that position and the next 2 positions. So the positions for the ulnar nerve gliding are, position number 1 is going to be with the elbow is going to be extended, the palm is going to be up, the wrist is going to be extended, and also radially, it's going to radially deviate it, just like this. Position number 2, you're going to take the other hand and you're going to add some extra stretch to the 4th and 5th digits, just like this. Position number 3, we're going to keep the tension on the 4th and 5th fingers, and we're going to flex the elbow and we're gonna pronate the hand. So it's gonna look like this. Good. And then after this, if they're not feeling any numbness or tingling right here, they're gonna progress this by doing shoulder abduction. That this is the fourth position. And by right now, they should be feeling some numbness or tingling right on this side. And then they can do the same with the other arm. And that is the ulnar nerve line. Okay, now the last thing that I would like to talk about today is something called dexterity. So dexterity exercises are very fun exercises that we can do with our patients to strengthen those intrinsic muscles of the hand, because sometimes they're not usually very strong and we don't usually work them out too much. So it's mainly to focus on those muscles and other and target specific muscles of the fingers. So some ideas of the dexterity exercises are going to be finger taps. We're going to have the hand flat and we're just going to tap. We're going to extend the fingers and we're going to tap the table like this. Another exercise, it's going to be finger walk. So finger walk will be just doing adduction and abduction. So this is going to be working the pads and the daps. So dorsal interosseous and palmar interosseous muscles. Then another exercise could be like just picking up coins. So that will help increasing the fine movements. Another exercise could be just take a rubber band and then just do exercises with a rubber band or a hair tie, like I have today, hair tie exercises. This will strengthen the extensor digitorum, the extensor pollicis longus, the interosseous muscles of the hand. And then there are some other fun exercises that we can also perform for the hand and the wrist. Okay, so this concludes my presentation. Thank you for your attention and I hope you have enjoyed it.